Hi, I'm Dr. Maria Cilindro, integrative anti-aging medicine practicing in Pasadena, California. Thank you for listening today. I am going to see if you like this program. Give me a big thumb up and click the subscriber box there. And you can share with your friends and relatives. And hopefully this will also bring educations to the community. Today, I'm going to talk about irritable bowel syndrome. And this irritable bowel syndrome is also called IBS. That's the abbreviations. It is a chronic situation about the gastrointestinal disorder. And it's not a disease, but it's a condition where you have all these symptoms together. So I'm going to divide the talk into three parts. The first one is what is it called irritable bowel syndrome? And the second part is how do we diagnose these situations and what tests do I use in my practice? And then the third part is how to treat this difficult and almost like a phantom pain syndrome, if you call it, but it's there affecting the visceral or deep inside sensory feelings or the fibers. So people have a lot of pain, abdominal pain. This impulses is from the internal organs and probably the glandulars and blood vessels to the CNS, central nervous system. First is what is IBS or irritable bowel syndrome? Syndrome means is a group of symptoms which consistently occurs together or a condition that is characterized by a set of associated symptoms. In this case, the affected part is the large intestine, which is called colon. Symptoms can vary, but usually it's abdominal pain and not just discomfort. Believe me, these people sometimes think that they are going to die. So some people call it catastrophic pain. That's severe. And that is the main symptoms. And usually it is accompanied by bloating sensation. You can imagine how uncomfortable they are. It can happen at any time. And perhaps it happened 4 days in a month or in a week and it lingers for 3 months or even 6 months before we can say that this person has irritable bowel syndrome. They have pain when they move their bowel. They have diarrhea, and that is called IBSD. When they have constipation, it's called IBSC. And when they have a mix of constipation and diarrhea, it's called IBSM, which is mixed. So some of the doctors that describe, I'm pretty sure there's so many people talking about irritable bowel syndromes, but some of them, they call it spastic colon or grumbling gut. Because when you listen to these patients, they describe it as the gut is grumbling. More often, it happens in women, twice as many. And it affects 1 to 20% of the populations. Currently estimated about 16 million American, they get irritable bowel syndrome. This IBS or irritable bowel syndrome was discovered since 1820. It's a long time ago. And the current system or terminology, it's called IBS. It was named since 1994. It is unpredictable when you can get this, but it is more common after the age of 45. Now, how to diagnose? Because this seems to be like so many people have diarrhea and constipation and also pain, and there are other conditions. So in my office, what we do, we find the cause, of course, which is you will not find the cause in irritable bowel syndrome. So this is called what we call exclusive diagnosis. So you have to rule out all the other possible diagnoses or diseases before you come to the conclusion of irritable bowel syndrome. When the patient comes, usually we make sure during the interview that they are familiar with whether they are dehydrated or not. And then this sign, especially when they are elderly, they do not know. They get a little confused. They are not very, receptive and all this. We need to make sure that they are not dehydrated. So if they do, we hydrate them as soon as possible. Otherwise, they have to go to the hospital. So then we test the blood. Why do we have to test the blood? Well, we make sure that it's not one of those irritable bowel disease, which is IBD. Now, what is IBD? Those are one of those autoimmune conditions or disease that can be diagnosed through the blood test. And those are such as celiac that happen in a small intestine, so it's before the colon. And then also ulcerative colitis, it is in the colon but involves the lining of the gut, so there is a damage in the lining of the gut, inflammation, and itis means infection also. The other one is Crohn's disease. This is very serious, affecting the lining of the whole digestive tracts, and which is from the mouth through the exit part. And it can be threatening, difficult to treat or cure, and it increases the risk of colon cancer. So, how about irritable bowel syndrome? Do they have inflammation? Yes, after a while, of course, the colon is inflamed, but not as inflamed as the disease. Okay, this is syndrome. So, but fortunately, or although the pain is so catastrophic, fortunately, this one you cannot find any problem with the colon. Serious, no problem. So, our we assume, or not assume, but we probably know pretty much that this is possibility of imbalanced microbiome, which is the trillions of bacteria that are in our gut that keep us going and have an energy and keep us healthy. It's called microbiome. It become imbalanced, and then it will affect the visceral lining of the nerve system, and it becomes hyperactive, so it will be very sensitive. So in our practice, or in my practice, we do variety of tests. And first one, I would like to mention it because it's very special. Although many people do not know yet, but I think this is a very useful testing. It's called hair follicle testing, and it is an epigenetic based testing. So basically, you pull the follicle of the hair, and in this situation, they will reveal several sections. I'm going to have a separate section of the YouTube discussing about that test with the inventor himself. Okay, so I'm going to just focus on this, how this help the irritable bowel syndrome. In this test, there is what we call a leaky gut situations. They explain to us the top 10 food that can create this inflammation. And since this is an epigenetic based testing, they also uh, advise us what to do and what to eat, what to avoid. Basically, it's very useful. The second one is called immunology testing. Now, this one is blood based, so blood test. What kind of food bothers the colon or create a problem of inflammation? And it's called the trigger symptoms, trigger food. And the third one, we can do GI maps. This is a stool testing, is to see what kind of food reacted to our immune system and both to the environment system. The immunoglobulin E and immunoglobulin G. For those of you who have this test, probably it's very helpful, right? And the fourth one is I will also refer to patients to a gastrointestinal specialist, and they will do colonoscopy just to make sure there is no polyp or ruptured cyst or cancer, right? So another testing, actually, there is a fifth one, is called Sibo testing. What is Sibo? SIBO. Small intestinal bacterial overgrowth. Well, we are talking about colon and now it's small intestine. Yes, because the symptoms is similar. So SIBO, they get bloated, they have stomach pain, they cannot eat certain things, but these will have bacteria found. So some people comes with irritable bowel syndromes, and if we find that they have positive bacteria growth in the SIBO testing, which is breath testing, the gas methane, hydrogen gas, so then we know if they are positive, then we treat them. And there is a drug of choice, which is the antibiotic. And usually gastroenterologists also give them this antibiotic twice. Unfortunately, these irritable bowel syndrome patients can have these two conditions. So once you treat the SIBO and they still have symptoms, then you know they have the irritable bowel syndrome itself. Okay? So what can we do for them? Meaning treatment, right? This is very important because they go in and out hospital emergency room thinking that they are going to explode and die. So this is the situations. So like I said, we first balance their nutrition and electrolytes. So and then after that, we order blood testing and then urine testing to see if they are depleted in electrolyte also. And the goal, obviously, for the patient is to eliminate and control the pain. But this pain is a visceral pain. It's almost like I'm not trying to be cynical to other specialty. So when I was in residency program, I was in psychiatric rotation, right? The first year I did psychiatry and neurology. So what's the difference between psychiatrists and neurologists? Do you know? So we said, well, the difference is if they are psychiatrists and they are trying to find the cat in the dark room, but the cat is actually not there. But the neurologist, they same thing. They're trying to find the cat in a dark room, but the cat is there. It's just they have to find it. So that's the difference. Now, IBD, IBS, irritable bowel syndrome, they have pain. But where is the pain? It's in the viscera. Where? In the viscera, right? In the deep inside your organ, and where? Because we test the blood, we test the urine, we test the colon, we test the wall. Everything is intact. So, but they still have the pain. So we call it like a phantom pain. So when the patient has this pain, I try to use homeopathic. This is where the homeopathic helps a lot, because homeopathic usually is a science that takes care of the symptoms first and makes your body become homeostasis. I took homeopathics just to learn how to handle difficult patients when we conventionally, integratively, or whatever, we don't know what to do, right? So homeopathic helps all the symptoms, the diarrhea, constipation, anxiety, the stress, and name it, the pain and diarrhea, they have everything. They have 1,800 kinds of products for 1,800 kinds of symptoms or more. If you combine them, then you get more, right? So what to do next if they still have a problem? Well, I said avoid the trigger food. So find the trigger food that might trigger the symptoms. So remember I said that follicle hair testing. So they list the top 10 food that is that leaks, that it is creating inflammation. So I said just avoid this food. Sometimes it helps, sometimes it doesn't. Yes. So I will say, okay, let's eliminate greasy, oily food, pizza, okay, heavy meals, just eat small portion, caffeine, coffee, alcohols. They are not allergic to it, but avoid it because they are in the sensitive situations. How about gluten? Again, gluten sensitivity maybe? Yes, it's real, but try to avoid it. But not completely not eating gluten, because if you're careful and you don't have celiac disease, which is the IBD, right? Some good grain has that are more organic and has no heavy metals. They are good to eat, and you need them. So I tell them just avoid temporary, and you feel better, then avoid the gluten. But if you don't, then it's probably not 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 bad to eat gluten, but it's the good one, organic one. How about yogurt, kefir? Now we are talking about microbiome now. That is the key actually. It's not an easy subject to take care. But how to balance microbiome, right? You need the microbiome, and now they are in balance. You don't even know which microbiome is not balanced. But I tell my patient not to be afraid to avoid all the food, because that creates anxiety itself, and it reduces the quality of life. So it might probably increase the pain, right? So that is the key. I mean, these people that are suffering from irritable bowel syndromes, they are very strong because they train themselves to be on time for their breakfast, small breakfast. In between meals, they have something and very clean, and then but still they get this explosion of the pain, abdominal pain. Now, since the colon of these patients are very sensitive, any stimulant like coffee, alcohol, those, they make it more readily for them to go to the toilet. So now you can imagine, right? Where is the toilet? They always are aware of where the toilet is. Even though they are like maybe 3 feet away, sometimes they missed it. This is why they become so afraid and develop this anxiety, for they might miss and become incontinent. Well, for the diarrhea, we always tell them take soluble fibers. You know what soluble fibers? Those are the fruit itself. Let's say it. You can easily get it as a psyllium husk, and this is from the flesh of the fruits normally, because the skin and vegetable, the roughage, all are insoluble, and that one is for the constipation. Now the diarrhea, you take the soluble, and the constipation, you take the insoluble, and drink water. Please drink water, because you can, even though you're treating diarrhea, and then you can become constipated if you don't drink enough water. These people that has IBS, they are very careful. They become very careful. Does it affect their lifestyle? Yes. So they have to change their lifestyle, and they, besides cutting the caffeine and alcohol, okay, because it has a poor effect on the IBS symptoms itself, they also have to cut on sweeteners, because this can cause diarrhea. So other would be like maybe add probiotic, not harmful. Probiotic, there are so many probiotic in the market, and it's not regulated yet. In fact, in my office, we even have 4, 5, 6 times of probiotic, and you just have to try which one. But with all the experience I have, so I know what to give, like the probiotic that has antibacterial, and because these people needs probiotic, because the microbiome is imbalanced, and then the probiotic will help. So on top of that, we also can use the over-the-counter medications. Like for the diarrhea, you use Imodium, Pepto-Bismol, believe it or not. And then homeopathics, again, homeopathics, okay? And then over-the-counter, you can use Dulcolac, Miralax for the constipations. And then in my office, I encourage everyone to do hydrocolonic, because we can also replace their probiotic with a good one, and viable one. And also I can introduce ozone treatment, rectal ozone. And you know, ozone is the O3 gas that can reduce drastically inflammation, kills bacteria, parasites, fungus, virus, and also improve the condition of the lining if it's inflamed. So this will reduce inflammation. So basically, the hydrocolonic will clean the colon. Okay, and also while cleaning the colon, what happens is you stimulate the wall and the peristaltic. So you might get your gastrocolonic reflex back that you probably lost it for a while. So even if you don't have irritable bowel syndrome, I advise everyone to have this on a um, regular basis, maybe once a month or once every 2 months. It's very helpful. I use a open system in my office. The last one is a little bit different, but because I have a background in rotation in psychiatry, I do believe that neuromodular medication is helpful. So this is antidepressants. These people, in and out, they have all these syndromes that is, very troublesome. They become stressful and depressed. So a little dose of antidepressant will help them to cope a little bit more with how to psych themselves. Okay, psych means make sure that they take their time and rest and assure themselves that this is okay. It is. They have to do that. This is the homework that they have to practice, to take time for themselves to relax, take a deep breathing. Diaphragma breathing is very useful for this kind of condition. They have to rest better, sleep better on time. If you heard of FODMAP, I call it food map, but FODMAP. So this is a diet that is linked to this irritable bowel syndrome, but it's very difficult. I rarely suggest it because I don't think I can do it. But FODMAP, I probably will have another YouTube explaining about this. But it's basically F stands for fermented, O means oligo, D means D. Fermented oligo D monosaccharides and polyols. Okay, that's the name of FODMAP. So what is this? This is basically a short chain carbohydrate that are poorly absorbed in a small intestine. Okay, and then prone to absorb water and fermented in the colon area. So why it's difficult? Because basically this one is no dairy, no veggie, no vegetable, no onions, no fruits, dried, no dried fruits, no juices. Okay, no legumes. So no beans, lentils, soy, wheat, rye, breads. No nuts, cashew, pistachios, sweeteners. None of those. um, you eat, extremely difficult. But this is a prebiotic. It's called prebiotic. And it feeds the symbiotic bacteria that helps microbiomes. It's not easy. So I'm going to discuss about that when I'm ready. But there is that kind of diet is usually one of the things that you can try to reset basically your viscera. Now, are we going to, hang on, I probably have some questions here, okay? Just one moment. Why do you think women have a higher percentage of having IBS? You know, I believe, Colin, that women has so much. You know how they explain. This the psychiatrist explain what's the difference between women and men's brain. Okay, so women have more tendency to uh, have stress and things like that, and then that can be. one of the reason. Now, I'm not saying that we can find the reason of IBS. We do not know, but why it happened to more to the woman. My personal reason, okay, woman has ups and down hormones every month, and then that's the reason why this happened more towards like age 40, seriously. And that's when it's your premenopause or menopause age. So the hormone ups and downs can affect the microbiome. This is my personal opinion, and I'm yet to see if they do the research. Thank you for asking. Second one is thank you, Dr. Maria, for all the information. See you tomorrow. Thank you. And then does one feel ill after receiving rectal ozone after having a colonic? Hang on. I still have more. So, no, depends. Ill, what do you mean by ill? Some people that has done colonic several times, they feel great because this is only is like the cream of the top of the ice cream, the best part. Okay, so basically it reduces inflammation and kills the bad bacteria. So some people will have to even hold it to make it stay a little longer just to benefit from the ozone. Okay, now there's a questions. Are we going to lose weight when you have the irritable bowel syndromes? You don't. And you don't want to have IBS to lose weight anyway, so it's terrible. But the reason why you don't lose weight, because nutrition is absorbed in a small intestine, not in the colon. Irritable bowel syndromes happen in the colon, where that is where all the waste product needs to go out actually. Okay, it makes sense, right? So they don't lose weight. In fact, if they can eat while they don't have pain, I encourage them to eat, but they have to follow those like small meals often, and try to avoid oily greasy things and coffee and all those. Colon is the one that has a challenge in irritable bowel syndrome. And then prior to my presentation, some people already asked me question, how do we know that treatment helps and how long do they have to take these treatments? Okay, anything we try, it has to be done more than cautiously. And let's say you have to pick up probiotic, you have to pick up cautiously and use it for 30 days before you abandon it. Many people, because of the pain, and they still in the first week they already abandon every program, and they cannot see the result. Okay, so then another question was how to balance our microbiomes. Microbiome's role is increasing to be uh, recognized as more important effects now. Okay, so in our system we have the endocannabinoid system, where we also needs the cannabidiol. So that is the cannabis. So I use cannabis to help balance the microbiome and probiotic. That's what I use, and I feel good. I change probiotic here and there, so I can experience whatever I need to experience, a good experience. And I also have like the immunoglobulin that derive from the serum of the cow that strengthen your immunology in your intestine. But you will see this month we are going to discuss about the gastroenterology, so gut system. So I'm very excited. And some people ask me, what is the prognosis of this illness? So I say, it can be chronic, it can be lifetime. Can you imagine lifetime? So, it, I feel bad because number one, we don't even know what caused it. Number two, there's nothing we can find that is abnormal except the symptom, which is pain and diarrhea and constipation. And then it can go on and on and on. But if you watched all these video in YouTube about irritable bowel syndromes. I'm so happy. Some of the patients will come up and give their own story about their own problems, and they can manage and get it almost their symptoms and go back to normal life. So, and let me see it. I think there is another one here. Hang on a second. Okay. I was amazed to get the results from the hair follicle testing in the same day. Yes, amazing. That's I think a very useful, even though it's not quite detailed. For example, if they said, okay, you avoid 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you have another immunology testing or allergy testing, because some people they get confused between allergies and trigger food or leaky gut food or something like that. So, but I said, you know what? If you can do these 10, you're good already. So yes, very good result. Now, some people ask, is it cancer? Is there causing any damages? No, it does not lead to cancer at all, and you cannot find the damage. And last questions, what do you think of the social impact on this irritable bowel syndrome? Social impact, I can say that it affects their job, and because it can occurs in a very young age. Some of the video I listened, they got it when they were 12, 15, 18, 22, and they got better at the age of 44. Some are doctors, and I really feel my heart goes for those kind of story. Um, well, they have to know, because in fact the social impact is like this. They have to know where the restroom is. Their fear of incontinence. Symptom can comes and goes. Does not matter what time of the day. That's the problem. Except during at. Good thing is when they sleep at night, it doesn't come. And whatever their social background, it doesn't matter. It is just like that. So for closing, I would say that I remember 4 things here. One, it is a very difficult diagnosis. It's an exclusive diagnosis. And then after you diagnosed, you feel a little better, because then the patient actually knows that that's it. They have to adjust their lifestyle and everything with these situations. And I tell them, don't be afraid. If you're strong and you can handle this impact, and that will lessen the anxiety and stress, and then you get better and better. And it does not affect the life expectancy, thank God. Okay, it doesn't make them live longer or shorter, and it doesn't lead to any serious diseases. Now, on top of that, I would say nutrition is the key. It's not diet, nutrition. Diet can be poisoned. Diet is food, right? So because we eat food that are already processed heavily, and from the spice to the food and frozen food and all those in canned food, so those food satisfy our taste, but it may disrupt and eliminate the toxin and stop the elimination of the toxin from our body. That will cause problem of the gut-brain connection. I'm sure you heard about gut-brain connections, and I'm going to cover that in my future YouTube. I'm pretty sure you all heard about this Thomas Edison's saying in 1903. So this, you know who Thomas Edison is, right? The founder of the light. So he said the doctor in the future will give no medicine, but will interest the patients in the care of human frame in diet and in the cause and preventive of the disease. Isn't that clever? And that was 1903. So what happened now? Well, like I said, the diet has been processed and engineered and altered. So in the modern medicine, where we are now, okay, We cannot just use the drugs to cover the symptoms. You can't. We take a closer look at the detail and we find nutrition is what we need, not just diet. Good diet produce good nutrition. So it's no longer just the food. It's more of the nutritions. So we can care about the prevention of the disease. Yes, you have to eat, that's number one. But the problem, if you cannot find a good food surrounding you, whatever you eat is not going to give you good nutrition. So people used to say, oh, you don't need supplementation, right? Remember that? So now what happened, right? Just during the pandemic, you can see that people are so panicked with immune system, and we do need to supplement if we do not have enough nutrition. So this has been done in China, Asia, India, more than 5,000 years, and we should do it everywhere. I'm Dr. Maria Solindro, integrative anti-aging, practicing in Pasadena, California. If you benefit from my information, please like it and subscribe and click the bell notification and share it with your relative and family and friends. And I'm live weekly on the same day at the same time, 5 o'clock on Thursday. And watch the channel for the early notification for the topic. Thank you for listening.